My name is Abigail, and I'm going to be doing my assessment on my mother. I'm going to start by washing my hands. Can you confirm your name and date of birth?
Dawn Testa, 8/5/55.
All right, and do you know what season it is?
Autumn,
And what year were you born?
55.
All right, and do you know where you are?
In my kitchen.
All right, patient is alert and oriented ×4. No abnormal facial expressions, grimacing, indicating pain. Patient is sitting upright, relaxed. Respiration seem to be even and effortless. And I'm going to start just by doing a general inspection. Hygiene, all good. And then just assessing temperature of the arms and the legs, capillary refill on the hands, less than 3 seconds. Same with the legs. Now I'm going to look for edema over the shin bone. No edema. Both legs are even in warmth and color. There's some varicose veins. While I'm down here, I'm going to look at the posterior tibial pulse, which is on the inside of the ankle under the ankle bone, and also the dorsalis pedis pulse, which is on top of the foot, underneath or in between the first and second toe. All right, 2+ for both of those. Everything seems to be good down there. Next, I'm just going to palpate the trachea and make sure that that's midline. Trachea is midline, and now I'm going to inspect for jugular distension. So I'm going to have you tilt your head to one side and lift your chin up. All right, visible pulsations but no distension. Same thing here. Now I'm going to begin by palpating pulses. So temporal, carotid, one at a time, and then I'm going to assess for bruit in the carotid arteries, and then I'm going to move to the radial, brachial, and then femoral and popliteal, which are more difficult to locate, and then I already did the 2 on her feet. So we'll start with the temporal pulse. Present on both sides, 2+. Carotid. Good. And now I'm going to use the diaphragm of my stethoscope and then the bell to assess for bruit in the carotid artery. It's just an abnormal sound that is indicative of something that's wrong. Everything looks good there. No bruit, no abnormal sounds. How you doing?
Very well.
All right, now I'm going to look at the brachial pulses. All right, and then radial pulse. Let me lift your hands up so they can see. Feels a little bit stronger on the left side, but once I moved my finger, found it on the right side and left, so we're good there. All right, where I did those pulses down there, so I'm going to auscultate for breath sounds. So first I'm going to auscultate for heart sounds. So I'm going to show it on me because they're a little bit more difficult to locate anatomically on her, but On the right side, at the second intercostal space, you have the aortic. Left side, second intercostal space, pulmonic. Third intercostal space, Erb's point. Fourth intercostal space, tricuspid. Fifth intercostal space, left mid-clavicular line is your mitral valve, and also this is the apex of the heart. So we're going to start by doing that. Listening for normal sounds. So we're starting with aortic. Pulmonic. Second intercostal space. Erb's point, third intercostal space, where S1 and S2 should both be heard. And S4, tricuspid. And S5, mitral. Alright, no extra heart sounds, S3, S4, no murmurs that I could detect, although I will say it is difficult to hear the sounds on her, so that's why that kind of showed where I would be listening for them. Alright, I'm going to have you stand, we'll do this first. First we'll auscultate lung sounds. So over the trachea in this superior area here, I should be hearing bronchial breath sounds. Right along the sternal border, I should be auscultating bronchovesicular sounds, and then the periphery, the major part of the lungs, I'm going to be hearing vesicular lung sounds, same on the back. So I'm going to do 6 auscultatory sites on the front, 8 on the back, 2 on the sides. So actually you can stand up, yeah. Alright, then face me. Deep breaths. Good. 5 and 6. And now I'm going to move to the 8 auscultatory sites on the back. If you can put your back to me. And deep breaths each time. Turn this way real quick. Just auscultating these lower lobes. Do some. Alright, and you can stay standing, but I just wanted to note no adventitious breath sounds, but I will say over the lower lobes of the left lung I did hear crackles, but I think a lot of that is due to just being on fabric, but ordinarily if you hear crackles you would have the patient cough and then you would repeat to see if those crackles are still there. So we did heart sounds, no abnormal heart sounds, we did lung sounds, no abnormal lung sounds, and now I'm just going to palpate for tactile fremitus. So I'm just making sure that the vibrations are equal on both sides and that there's not increased tactile fremitus or decreased tactile fremitus, because that would indicate either pneumonia or pleural effusion. So say 99.
99.
99.
99.
99.
99.
Cool. And then turn to the front. And face me. And same thing, 99.
99.
Good job.
99.
Last one.
99.
Okay. Alright, so good good on the tactile affirmatives. There was one other thing. I'm gonna thoracic expansion. So first of all, I need to note that the thorax is symmetrical. Looks to be evenly developed on both sides. No barrel chest that I can notice. No pectus excavatum or pectus carinatum. And now I'm gonna have you turn around. This way. Yeah, you can face the oven. And for thoracic expansion, I'm just gonna note that if the thoracic expansion is even, so go ahead, take a deep breath. And my thumbs should be going in and out at an even on both sides. You're all good, you can take a seat. So that was symmetrically bilateral, indicating that thoracic expansion is good. Respirations were even effortless. Everything seems to be good there. Do you have any questions?
I don't.
Also,
Good job.